Good afternoon, everyone. Thanks for joining us today. I'm going to start with the usual update on the statistics. Before I do that, though, I need to point out that there has been a technical issue with our reporting systems overnight, which means that today's figures might be slightly lower than we would expect. And of course, that means that figures over the next day or two might be a wee bit higher than usual, as it could be the case that some cases which should have been reported today will be included in the figures for the next couple of days. So when you're looking at the figures over the next today and the next 2 days, just bear that point in mind. However, I can confirm that the total number of positive cases reported yesterday was 369. That represents 6.1% of the total number of tests. The total number of confirmed cases overall now is 95,058. 133 of these new cases were in Greater Glasgow and Clyde, 49 in Lanarkshire and 48 in Lothian, and the remaining cases were spread across the 8 other mainland health board areas. 1,041 people are currently in hospital. That is a decrease of 8 from yesterday, and 75 people are in intensive care. That is 1 fewer than yesterday. And finally, I have the sad duty to report that 3 additional deaths have been registered in the past 24 hours of patients who first tested positive over the previous 28 days. But again, as I do every Monday, I would draw to your attention that registration offices tend to be closed at weekends. So the figures we report for people dying on Sundays and Mondays can be artificially low as a result of that. In total, since the media briefing that the Health Secretary led on Friday, 49 deaths have been registered, which means that the total number under this daily measurement is now 3,725. And again, as it does and should every single day, that should make us stop and think about the heartbreak that this virus causes. And as always, my thoughts and my condolences are with families who are grieving the loss of a loved one from the virus. Now, tomorrow I will, again, as I do every Tuesday, update Parliament on the levels of restriction that will apply in different local authority areas. We are, over the course of today, continuing to assess those areas that are currently not in level 4 to see whether we think any area needs to move up a level to tighter restrictions, or, on the other hand, whether any could move down a level. And I will report on that in Parliament tomorrow. Remember, those 11 local authorities in level 4 will remain in level 4 until the 11th of December. For today, though, there are 2 points I want to update on. The first relates to a further expansion of our testing. We are now starting to test residents in a number of communities across the country, even if they do not have symptoms of COVID. These programmes are being trialled in several communities in Central and West Scotland where rates of COVID continue to be of concern and are higher than the national average. For example, a mobile testing unit opened in Clackmannanshire in Alloa Town Hall on Thursday, and further sites have opened today in Dalmarnock in the East End of Glasgow, in Pollokshields in the south side of Glasgow, in Stewarton in East Ayrshire and in Girvan in South Ayrshire. We will also open the first site using lateral flow tests in Johnston in Renfrewshire on Wednesday of this week. The lateral flow tests produce results much more quickly than the conventional PCR tests. That potentially makes them very useful. All positive cases, though, that are identified through lateral flow testing can then be confirmed by a PCR test. The testing site in each area will be open for between 3 and 13 days, depending on the location. And the work to establish these centres has been led by local partners, including, of course, the relevant local authorities, and I'm very grateful to them for their work and assistance. The lessons that we learn from these trials will then inform our plans to expand community testing much more extensively and much more routinely early in the new year. Of course, it's important to stress that any test will only tell you if you are positive at that point in time when you are being tested. They will not necessarily show up if you are still incubating, the virus. So they don't mean that you can or should stop following all of the other safety measures in place, because and they also cannot tell that even although you're negative one day, you don't pick up the virus after you've had the test and might be positive a day later. So please continue to follow all of the advice on self-isolation if you have symptoms, distance, face coverings, all of the other things we are advising people to do. But that aside, we do hope that identifying more people who are positive will help us ensure that they are not spreading the virus. And that's why we are currently focusing these trials, these pilot programmes, on areas with high prevalence. So if you live in one of these areas, I would encourage you to come forward for testing. You give yourself the chance of finding out if you have the virus but you don't yet have symptoms, but you're also helping that collective effort to try to break the chains of transmission. And you can find out more details, of course, on the NHS Inform website. And if you do have symptoms, remember the advice still stands. Wherever you live in Scotland, if you have the symptoms of COVID, you should come forward for testing. Now, the second issue I want to update on is a change to the eligibility rules for our self-isolation support grant. You'll recall that that is a payment of £500 for people on low incomes who would otherwise lose out financially when they self-isolate for public health reasons, when they're advised to do that by Test and Protect, for example. So it is an important way in which the government can support people to do the right thing as we all try to tackle COVID together. From next Monday, that's the 7th of December, we are making two changes to try to widen the range of people who are able to claim the support grant. So firstly, up until the 7th of December, you can only get the grant if you yourself have been asked to self-isolate by Test and Protect. But from next week, you will also be able to claim the grant if you meet the other eligibility requirements, if one of your children has to self-isolate from school or nursery, and that means that you're not able to work for that period. The second change we're making relates to the fact that you can currently only receive the grant if you receive universal credit. But again, from next week, you will also now be eligible, even if you don't get universal credit, if your local authority believes that you would qualify for it if you applied. So that change will help more people to get the grant as quickly as possible and hopefully reduce the chances of people missing out on it. These extensions to self-isolation support are important because self-isolation is so important. As I said a moment ago, if you have symptoms of COVID, you should self-isolate immediately and take steps to get tested. And if the test shows that you have COVID, you should self-isolate for 10 days from the date of the test. If you're a contact of someone with COVID, you'll be advised to self-isolate for 14 days, and you'll be told by Test and Protect what the starting point is for that time period, and therefore what the end point is after 14 days. Now, as I've mentioned, children will sometimes be contacts and will sometimes therefore be advised to self-isolate. And self-isolation is a crucial way in which we can stop people who have the virus or who might have the virus but aren't yet infectious from going out and about and transmitting it to others. So it's an important contribution that we all might need to make at some time, and it's important that when we are advised to do so, we follow that advice. But we recognise that self-isolation for a period of 10 or 14 days is a really tough thing to be asking people to do, and particularly tough for people on low incomes who might not be able or be less able to work from home and be less likely to have access to statutory sick pay. And we don't want anyone to feel that they're having to choose between self-isolating and feeding themselves and their families. So I hope today's expansion of the support grant will help more people do the right thing if they are, or their children are asked to self-isolate. Now, I've spoken today about testing and self-isolation. These are two really important ways of trying to reduce transmission. But I'll close, as I always do, by summarising the other key rules and guidance which we should all follow right now to try to keep ourselves safe and reduce the risks of transmission. And remember, if you're in any doubt about what level your own area is in and what the rules are that apply where you live, you can go onto the Scottish Government website and enter your postcode and you will get the information there. But in summary, You should not be visiting other people's houses right now unless you live on the islands, unless you've got an essential reason for doing that. And if you meet people outdoors, keep to the limit of 6 people from a maximum of 2 households. Please abide by the travel restrictions, which are really important right now to stop the virus spreading from high to low prevalence areas. Avoid car sharing if you can, work from home if at all possible, download the Protect Scotland app, and finally facts, which are the basic, not easy, but basic things we can all do to try to stop the virus spreading. So remember face coverings, remember to avoid crowded places, remember to clean your hands and surfaces regularly, remember to keep a 2-metre distance from people in other households, and as I've already said a couple of times already today, remember to self-isolate and get tested if you have symptoms. So thank you very much again for listening. I'm joined, as you will see, by the Health Secretary and by the National Clinical Director, and we will all now take questions, as we usually do, from journalists. And the first journalist up today is Andrew Kerr from the BBC.
Thank you very much, First Minister. You raised some of the issues surrounding lateral flow tests there. Are you concerned about the accuracy of them and the possibility that they could be providing a false assurance to some people? Thank you.
I'll ask Jason maybe to say a bit more on the technicalities of lateral flow testing. I think anybody who's listened to me consistently, and if you have done that, I thank you for that. I'm sure it's not easy. But anybody who's listened to me over the course of the pandemic will have heard me recognise the importance of testing. It's become an increasingly important part of our tactics against the virus, but also be quite candid about the limitations of testing. It can never be the be-all and end-all of our approach because of the limitations of any test, that it is a decision in a moment in time of whether you are positive or not. If you test negative today, it doesn't mean that you definitely don't have the virus, because you could be incubating it but not yet shedding the virus, or you could genuinely be negative but walk out of the testing centre and come into contact with somebody who gives you the virus. Now, that's true of the PCR test, and there are different assessments around the sensitivity and how specific the lateral flow testing is, and I'll ask Jason to say maybe a word or two more about that.
So one of the toughest things diagnostically about this virus is its long incubation period. We would much rather it was quicker. It's a horrible clinical virus, but it's also a horrible virus to diagnose, because you can have it and it can be a surprise when you suddenly then show symptoms a week, even 10 days after you were infected from some source. The testing is part of the solution to that, but it is not magic. It is not any test is not 100% successful. Lateral flow is new technology. It allows us to add that into our existing PCR technology. It is not as sensitive, so it does not find as many positive cases as the PCR test does. But there are 2 things we do in order to get over that. We do it more than once. So what you lose in sensitivity, you make up for in frequency. So you can do it a couple of times. For instance, their new announced student testing will be 2 tests rather than just 1. And then to avoid any false positives, which is the other side of the equation, we will retest all of the positives with our full-on PCR testing, just to make sure that everybody is getting the best result we can possibly give them. The reality is that the technology of testing is changing weekly around the world, and we will continue to change our testing advice as that technology improves. And the general UK public health advice is that lateral flow testing provides one of the building blocks to help us.
Thanks, Jason. Gordon Cree from STV.
Thank you. I'm at Queen Margaret University, where lateral flow testing centre has just started today. There seems to be a good uptake, but it is voluntary. Why is this not compulsory for any student planning to go home for Christmas? And can I ask the Health Secretary for any update on reports we've seen over the weekend that vaccination of healthcare workers might be able to start as soon as next week?
I'll hand over to the Health Secretary. We will start vaccination as soon as we have supplies of the vaccine to do it, and the Health Secretary will say more about that. I'll ask Jason as well, from a clinical perspective, to comment on the question of compulsory testing. I think there are ethical issues around making it compulsory for somebody to get any kind of test, and that would apply to a COVID test as well. And there are often boundaries and lines around this when you're talking about any kind of clinical intervention. And some of these tests are invasive, and therefore that has to be taken into account. But that does not take away from the fact that the very, very strong advice to students is to get tested, not just the once, but twice before travelling home. And anybody in areas now where we're doing asymptomatic testing, please come forward for that, because you're helping us to trial how effective this can be in driving down rates of infection. But like many other aspects of clinical care, there are lots of complex questions about making that compulsory. But I'll maybe let Jason say a word about that, and then I'll hand over to the Health Secretary on the vaccine point.
I think you've covered it well, First Minister. Clinicians are always very anxious about making something compulsory. This test requires consent. It requires you to be able to come forward. In fact, one of our challenges in care home testing has been sometimes that consent is, of course, difficult to establish, and you've heard us talk about that many times. We think the best way to do this is to educate, inform, talk to the student body about why, about it being necessary to protect them, but also being very helpful to protect those they are going home to visit, perhaps elderly relatives, perhaps mum and dad, perhaps siblings. So we think it is an additional measure, along with all the other things. It's not the only thing we're asking students to do, it's part of a whole package in order to help the students return home safely.
And Jeane.
So there are two important UK-wide bodies that have to reach decisions on any vaccine. The first is the regulatory body, the MHRA, who will be currently looking at the Pfizer vaccine, all the results from their clinical trials, and reaching a view on to confirm that that vaccine is safe to use. The second is the Joint Committee on Vaccinations and Immunisation, who look at any vaccine and determine the priority in which any group of the population should be vaccinated. We're waiting on the regulatory body to give their final approval to Pfizer. They will then go on and look at the Oxford-AstraZeneca vaccine. As soon as that approval is given, then we have distribution and supply dates that will then flow from that. But the most important point, so we can't influence that. That, quite rightly, both of those bodies are independent of all governments, and they will reach their decision as quickly as they believe they can, whilst doing it safely and properly. What we're doing is planning to be ready. As soon as the first vaccine is approved and the supplies arrive, then we are ready to begin vaccinating according to what that Joint Committee says are the first group of people who should be vaccinated for against COVID-19. So we're ready to go as soon as those approvals come through. At this point, any dates at all are entirely speculative, and I think as soon as we have a date, then we'll make sure that the population and the public of Scotland not only know when we can begin vaccinating, but what will be the order of the groups of the adult population that we'll be vaccinating and why that order is the one that we'll follow.
Thanks. Peter McMahon from ITV Border.
Good afternoon. Thank you, First Minister. First Minister, there are now 28 cases of COVID at Dovecote Court in Peebles. It's up a bit from when it was first reported on Friday. Services there are provided by SB Cares, which is part of Scottish Borders Council. And SB Cares was also associated with some of the services it provided and provides in Jedburgh. There was a cluster there, as you know, in October. I just wonder whether or not you or your advisors consider that to be a potential problem, or whether something to do with the care that's been provided, or whether or not this is just simply an unfortunate coincidence, and what you're doing to monitor this.
I'm not able to give you a definitive answer to that, but we look very carefully at all outbreaks in care homes. Local directors of public health do that with the broader public health teams in any area, and that will definitely be the case here as well. Obviously, and this is the body that we would look to tell us whether there were any to use your word, problems in a care home is the care inspectorate who has the responsibility to monitor standards in care homes and make sure that if there are any deficiencies in those standards, then they are drawn to our attention and action can be taken. I'll hand over to Jason, and if Jeane wants to add something to that as well. And if there are any particular issues around the care home that you are talking about, then they would be addressed in the normal way.
Yeah, we are aware of the outbreak, as we are with the outbreaks in every care home in the country. There are layers of support in place at this care home, both from the care inspectorate and from the local public health leaders in Peebles and the Borders. There has been testing provided to all staff and residents who are able to consent for testing. I understand 94 staff and residents have been tested. Very, very unfortunately for those who have loved ones there, visiting has had to be pulled back except for very essential visits since that first positive case. We continue to look after that home and those in it. We have no reason to believe that this virus, remember, is anybody's fault. So trying to find a provider to blame is not really helpful. What we want to do is support those providers using our best public health expertise that we possibly can to get that home COVID-free just as quickly as we can.
Jeane, do you want to add anything?
I just want to add a couple of things about the overall approach that we take in any circumstance, so not particularly about this home, but it will cover that home. It's partly, as Jason has just said, so we're advised of any outbreak. The Care Inspectorate is advised of a single case, and then the Directors of Public Health, the local primary care team, step in to see if there is additional support that they can offer. We check to make sure that the care home concerned has all the PPE that it needs, that it has the staff rota that it needs, and that it is finding it straightforward to be actively involved in that weekly care home staff testing regime. And if there is anything that needs to be done, then we make sure that is done. And the final point to make is that the Care Inspectorate is undertaking a significant number of inspections of care homes. They look particularly at where they think additional support is needed, and they look to ensure that that support is provided. And they publish their report on a regular basis in Parliament and on the relevant website. So it's possible to see the degree of oversight and regulatory work that they are doing constantly throughout this pandemic.
Thanks. Fraser Knight from Global.
Thank you, First Minister. New guidance in England for the run-up to Christmas says that carol singing will be allowed, including by choirs and including small groups going door to door. Has the advice and the evidence around singing and the transmission of coronavirus changed at all? And after you banned guising at Halloween, will people be allowed to carol sing in the lead up to Christmas here in Scotland as well?
I'll maybe ask Jason to say a word. I have not personally looked at the English guidance, so obviously we will, look at any guidance and consider the advice that we give to people. I'm not aware of the general advice in terms of one of the ways in which the virus can transmit, which is singing or shouting or being in close proximity to people where you might be speaking over music or something, having changed. But obviously we look at that on an ongoing basis. But Jason, do you want to add anything?
My understanding is also, if anything, that evidence has hardened from the aerosol transmission, brief aerosol transmission, particularly in unventilated areas for choirs and for singers. It's very hard for those, particularly in worship services, and those who enjoy singing in their choirs to have to stop that for now, but that remains the advice. We haven't taken a position on outdoor carol singing. That would be less risky than indoor, but you have to remember we have restrictions on the numbers who can meet, and door to door would also worry me. So going from door to door, I'm afraid we would be presented with the same challenges as we were at Halloween. So my instant advice, if you'll forgive me for doing it, is that probably not.
But we will obviously look at any change guidance in England and consider whether there is a case for us to change ours as well. So if there's a change in that, we will make that known, obviously. Lindsay Hannah from Bauer.
Thanks, First Minister. At a time when football clubs are calling for the return of fans, could what happened last night at Celtic Park potentially set any plans back? And just to add to that, if you don't mind, the SPFL says football clubs are well placed and ready to assist with the vaccine rollout by making stadiums available. Is this something being considered?
Yeah, I mean, we'll consider the offer from the SPFL on the availability of stadiums. Obviously, as we roll out mass community testing, we'll be looking for venues to do that. So that's a welcome offer that we will consider. On the issues with Celtic, look, I'm not going to get into any of the football aspects of this. You know, I get grief from all sorts of sides in football whenever I say anything about football. Please, anybody who thinks I am influenced in what I say here to do with any football affiliation doesn't know me very well. That's not the case. So what I'm about to say here, I'm just not going to particularly relate to football, but clearly your question is about gatherings outside Celtic Park last night. We have advice against gatherings. And every day I stand up here and say avoid crowded places. We have a limit on people coming together outside of 6 people from 2 households. So it stands to reason any group of people that are gathering together in a crowd are putting themselves and others at risk. And whether it's football fans, rugby fans, any other kind of sports fans, or just people in general, please don't do it. Because right now, in the middle of this pandemic, it is a risky thing to do that puts you and other people at risk. And that is very firm advice that has come consistently from us and, you know, unfortunately requires to be the case for some time yet. Neil Pooran from PA.
Thanks, First Minister. You might have seen the reports today that the SNP conference host, Hayley Matthews, has previously been sharing conspiracy theories about coronavirus and QAnon stuff online. I was wondering if you were also aware that Hayley Matthews had also been involved with the Scottish Government's Parent Club website. Will this be put under review, and will there be any sort of review into whether any misinformation has been spread? And given you warned about the dangers of misinformation recently, should greater care have been taken about who the party chose as the host of the conference?
On the Parent Club thing, I'm not aware of that, but obviously we'll look into that. What I do know, and I've put messages myself on Parent Club over the course of the pandemic, as has Jason, that the information that goes out on that, obviously given the intended audience, is very, very carefully quality checked, and there's a really robust sort of consideration given to that. So regardless of who's communicating it, the content of the information is of paramount importance, but I'll take that one away. I don't want to go too far into SNP conference because it's not a forum for that, but I have seen the reports in the media today. Hayley Matthews she's a professional presenter that we have hired as part of the technical team to sort of stitch together the online conference we're having right now. The views that I have seen attributed to her in the media today are absolutely emphatically not the views of the SNP and obviously not the views of the Scottish Government. I read a comment from her this morning that says she will absolutely get the vaccine when it is available. But let me be very clear, I've stood up here almost every day for 9 months to advise people about public health risks. I will continue to advise people to do the right things and when the time comes to get the vaccine. So clearly these are not views that I would endorse in any way, shape or form. Christine Lavelle from The Sun.
Thank you, First Minister. Just wanted to ask, this morning on Radio 4, you said mistakes had been made during the pandemic, in particular over care homes. What specifically are the mistakes you made around care homes, and can you give us some examples? And I know you spoke just kind of briefly there on gatherings, but I just wondered what your reaction was to the scenes outside Celtic Park last night with police officers being attacked and the like.
I've already given my reaction to the Celtic Park scenes. The only thing I would say in addition to that, I don't care if you're a Celtic fan, a Rangers fan, a Near United fan, no fan of football at all. Anybody who attacks police officers is doing wrong, and that is pretty despicable. And I would say that across the board, regardless of football or any other sporting affiliation. You would know the answer to the first question, presumably you do, because you will have listened to Radio 4 and perhaps not, given that they started pretty early this morning, the other interviews I've been doing. And what I was trying to say is that in this pandemic, whether it's care homes or anything else, this government, all governments will have made mistakes, and by mistake we'll just have got things wrong. But there are other things, and I think this is relevant to care homes, where some of the things we did that people now look back on and say that was a mistake, were because we know things now that we didn't know then, and that's particularly true around asymptomatic testing, and that's what I was talking about on the radio this morning. In the fullness of time, there will be proper inquiries into all aspects of handling of the pandemic, including care homes, where there'll be an opportunity to look in these things in more detail. Right now, we continue to be focused on steering the country as safely as possible through the remainder of the pandemic. Derek Keeley from the Courier. Derek, are you there? No. In that case, I'll try Derek later in case he's having difficulty connecting, but I'll go to Rachel Watson from the Daily Mail.
Thank you, First Minister. Advice from the UK government says that Santa's grottos can open and that Santa will not have to wear a mask for children, but that children can't sit on their knees. Do you have similar guidance in Scotland? And also just on the local testing of asymptomatic people, how many people are you expecting to come through there? Is there a certain number that you would, or percentage of residents that you would like to see take up this opportunity?
Obviously, I don't know how many people are going to come forward before it happens. We want as many people as possible to come forward, but part of the reason we're doing pilot exercises is to assess the uptake and work out whether there are particular things we could usefully do in future to promote uptake. On Santa's grottos, important issue, I know, for lots of people watching, or at least their children. I'm not necessarily expecting lots of children to be watching right now. I know we are working on guidance for Santa's Grotto. I'm not sure if it's been published in full yet, so we will publish that as soon as possible. Unless there's anything you want to add.
That's it. We've been working on it over the weekend.
Yeah. Tom Martin from The Express.
Hi, thank you, First Minister. You briefly touched upon tomorrow's review, saying some areas might be getting moved up a tier. What areas at the moment are giving any cause for concern, particular cause for concern in terms of rates that you're seeing?
I don't want to sound as if I'm nitpicking here, Tom, but I didn't say some areas might be getting moved up a level. I said we're looking to see whether there is a case for that in any area. We haven't actually made that decision yet. I know that sounds a bit pedantic, but it's just important for me to be clear. And I don't really want to start to pick out areas. You will have heard me talk over the course of the last week to 10 days of areas. I think I was asked in the last briefing I did here about Aberdeenshire, for example, and so that's been an area we've been looking at closely. There have been some outbreaks there in food processing plants, but we've been looking to see whether those account for all of or most of the increase in cases we've seen, or if there is an indication of wider community transmission that's driving that. I don't fully know the answer to that question yet. That's one of the things we'll be considering over the course of today, but we'll be looking at all of the areas that are not in level 4 to see whether there is a case for them having to have tighter restrictions, or indeed whether we can loosen restrictions a little bit, and we'll come to these conclusions over the course of today. Cabinet on a Tuesday morning always takes the final decisions here, and I will make a statement to Parliament tomorrow afternoon. Conor Matchett from The Scotsman.
Thank you, First Minister. I'm not meaning to follow on Tom's question with another question about a local area, but I've just had a look at the City of Edinburgh's stats over the last week, and after a good couple of months hovering at about static for cases per 100,000 and also for positive tests, there's been quite a significant drop in the last week. I'm wondering if you or the Health Secretary or Professor Leitch could shed some light on why that's the case, whether or not that's just a reporting issue, or if it's a sign that restrictions are working.
I very much hope it's the latter. I don't know whether Jeane or Jason have anything, probably more likely Jason might have anything to add there. But we do know restrictions can take a while to work and to feed through into the numbers. We also know, and I suppose, and I don't want MD to necessarily read into anything in this around Edinburgh, we also know that we have to look at more than just a few days to give ourselves a sense of assurance that there is a sustained downward trend before we loosen restrictions, for example. So across the whole country, we'll be looking at that carefully. What we know is countrywide, we are seeing cases fall in the sort of stubbornly high central belt areas. We are, and I'm crossing my fingers as I say this, I think we are a bit more hopeful now. We're starting to see a decline in these areas. Renfrewshire perhaps is the area that still gives us most cause for thinking it's still quite stubborn. But there are positive signs generally across the country, but we will have pockets at any given time that we're looking a bit more carefully at, and we will want to see sustained positive trends in areas before we loosen up restrictions. The point that I've made many times before is when you take an area down a level, it's not a neutral act. You are loosening restrictions, so transmission is likely to increase again. So we need to make sure that an area can sustain that before doing it, and these are the kind of things we'll be looking at over the course of the day. But I don't know whether you want to add anything about Edinburgh, Jason?
Yeah, so one of the challenges with this disease, apart from the incubation period we talked about earlier, is the time it takes for the numbers to fall. It's much easier for the virus to rise than fall. So Edinburgh City does look better in the last 7 days. You're absolutely right. It's 16% down in number of positives per 100,000. It is only 0.8% down in test positivity, so we shouldn't get too excited. So in the last 5 days, up to the point I have here, which is the 26th of November, because you have to have a lag time to allow the tests to come through, the per 100,000 number is 86, 90, 85, 85, 82, 74. So it is on a downward slope, but it's very, very slow. And we should be cautious overreacting, but we should be positive, cautiously, that the people of the City of Edinburgh appear to be following the guidance in such a way that gets that test positivity down, and that's really encouraging.
Thanks. Mark McLaughlin from the Times.
Good afternoon. The government in Westminster is looking at guidance for care homes to allow care home residents to leave the home to visit family for Christmas. Will there be any similar guidance for care homes in Scotland? And maybe one for Jason. Just to return to the point that I discussed with the Health Secretary on Friday, I suspect this is going to be one of these ones where half the country will think it's common sense and the other one's going to want absolute granular detail. So given the advice to elderly people, is it safer outdoors or indoors with all of the doors and windows open? And your general advice in a normal winter is that winter mortality is higher in poorly insulated homes. What is the actual guidance if it's a bitterly cold winter? Should you cancel your Christmas with Granny, or should you sit round the pasting table with your duffel coat on?
Okay, I'm not sure we're going to insist on everybody wearing a duffel coat, even during the pandemic, but I'll maybe not lighten the mood too much given the seriousness of the questions you're answering. I'm going to ask Jeane to say a word about care homes and people within care homes perhaps going to family homes, and then I'll ask Jason to try to give some advice on the do's and don'ts around outdoors. The one thing I would say is almost in anything we are advising people on right now, in my experience over these past few months, is that some people think it's right and some people think it's wrong, and that's why we're just having to try to navigate the best way through these things, recognising, particularly at Christmas, that people will be anxious about making sensible judgments, particularly for the safety of loved ones and particularly elderly loved ones. But Jeane, do you want to say a word about care homes, and then I'll hand to Jason?
So we currently have a position right now where people who are under the age of 65 in adult residential care can go on the outings with family or friends, out for the day or the afternoon, or an overnight stay, if that's what they wish. There are a number of precautions, of course, around that, that need to be undertaken, but families and loved ones, of course, know those very well, and the care homes know what to do too. What we're currently looking at is whether or not there can be any further easing of that for older residents in adult care, particularly around the Christmas period, but we've not yet concluded that. The clinical work is still underway around that, and a number of other issues around how we might make it easier, both for indoor visiting for longer periods across all adult residential care, but also whether or not there is any possibility, depending on the level of prevalence in the local community, to increase the opportunities for individuals to visit the family home or go out for the afternoon or whatever it is they might want to do.
And Jason.
One of the big challenges, the First Minister just said it, and I think, Mark, you acknowledged it too, is that some of the country want very specific advice and some of the country want no advice at all. My mum has always taught me that if I'm asked a question, I should do my best to answer it as truthfully as I can. I was on a phone-in on Friday morning and an absolutely lovely lady phoned in and she said, I and my old bod friends, her words, not mine, want to meet outdoors on Christmas Day for a glass of bubbles. Is that as safe as it can be? And I said, I think that sounds like a great way for you to celebrate your Christmas, and I might come too. The second bit was slightly more flippant. That lady didn't need advice about wearing a coat. She didn't need advice about how to celebrate. She was perfectly capable of making those judgments by herself. That then has been extrapolated into me telling people, old people, that they should meet only outside. That's not what I said. Outdoors is safer than indoors, but I'm not suggesting whole Christmas dinners outdoors, pasting tables or not. People should be sensible. They should adapt to their own family situation. So my family is not going to have an indoor celebration. Others will have an indoor celebration. If you're doing that, you should ventilate the room as much as you can. You should keep distant as much as you can. You should wipe down the surfaces as much as you can. Winter excess mortality is not because you have your windows open on Christmas Day. Winter excess mortality is because of long-term respiratory disease, deep-seated inequalities, etc., etc. So I think the vast majority of people will have a very common-sense celebration, and that might be a brief toast with bubbles outdoors, or it may be that you have a safe indoor celebration with you and your family.
As safe as possible. I think the important point we would make is there is no way of eradicating the risk of people coming together indoors during a pandemic. And the default advice, Jason's right, if people are intent on meeting indoors, we've tried to put as much guidance and boundaries around that as possible so that it can be as safe as possible. But that doesn't mean it's risk-free. Our default advice to people is if you can get through Christmas without meeting other households indoors, that's what we would encourage you to do. And we'll try, in the period between now and Christmas, to give as much common sense advice as possible. But it, as I say, probably won't extend to wearing duffel coats versus any other kind of outdoor clothing. But I hope people take the serious of intent that we're trying to guide people through what I know is a difficult period with a natural desire to see people you love. Last question today is Simon Johnson from The Telegraph.
Good afternoon, First Minister. 12 days ago, the Scottish Government published an evidence report that said there's no current direct evidence of transmission within schools playing a significant role in increased rates of infection among children. There was no difference between test positivity rates of teachers relative to other worker groups of a similar age. And it pointed out the well-being and mental health drawbacks of having children outside schools. So given that, why is it even under consideration to shut schools for almost 2 weeks extra over the festive period? And looking at the impact on working parents and the way they'll have to rearrange their lives, a lot of parents at this time of year, maybe in the retail sector, will be taking on extra hours overtime so they can make some more money before Christmas. I mean, if this goes ahead, they'll have to stay home with children who are perfectly fit and healthy instead of making that extra money. So what would you say to them?
I would say to them what I'd say to everybody. We try to take these decisions as carefully as possible and recognising there's no such thing as a perfect decision in the situation we're in. We haven't reached a decision on the school term. You know, we have been considering is whether for a couple of days at either end, because it may be the case that children are interacting more with others over that period, whether there is a case for that, and if and when we reach that decision, we'll communicate it properly. But every single decision we're making right now, trying to control the virus, is causing harm and suffering in other ways, and that's what makes this such a difficult thing to get through for governments and, more importantly, for people everywhere. But we take these decisions as carefully as we can.
There doesn't seem to be much scientific evidence in the paper you published for either transmission among children,
Simon,
or transmission
that is
between...
true, but that is absolutely true, and the evidence we've published, it comes from the ONS, it comes from Public Health Scotland. Nobody is trying to kind of sort of negate that in any way, but we are going into a period where there may be more mixing, despite the advice we're given to try and avoid it, with different within different generations as possible. So we're thinking about whether that requires us to take any greater precautions. And we're not trying to make life difficult for people here at all. We're just trying to think through all of the possible things that we can do to stop people getting the virus and hopefully stop more people dying from the virus. So there's no agenda here to make any working parent's life more difficult. Trust me, that's the last thing I want to do. But I will get questioned rightly and properly on a daily basis about the prevalence of the virus and the number of people dying. So these are just the complex decisions we have to think our way through as we try to get the balances right as we possibly can here. That concludes the questions today. So my thanks to all the journalists and to Jeane, Jason and Jill for our BSL interpretation. I will be back here tomorrow, not here tomorrow. I'll be in the Scottish Parliament tomorrow, and because of that it will be slightly later, I think round about 2:20. If you're able to tune in, please do that. And in the meantime, please continue to follow all of the guidance and all of the rules, because we do know it makes a big difference. So my grateful thanks to all of you, and I will see you from the Scottish Parliament tomorrow. Thank you.